morning and welcome to Radio Friends on Wednesday, April the 26th. Pleasure to have you with us today. Want to introduce a doctor who has making her first appearance on Radio Friends. Good to have you here.
Hi.
Dr. Lisa Brennaman with MU Healthcare, right?
Correct.
Actually, you're over at Women and Children's Hospital.
Correct.
Which is a beautiful hospital since it's been all redone.
I would agree.
But you're here to tell us a little bit and talk about pelvic disorders.
Yes.
That's your specialty, right?
Correct. So I am a subspecialist within obstetrics and gynecology called Female Pelvic Medicine and Reconstructive Surgery, which basically deals with problems of prolapse and incontinence in women. So women who may be suffering with difficulty with bladder or bowel control or having symptoms that their pelvic organs may be dropping or prolapsing are women that we care for.
When would a woman come to you at first? Because do you try to deny, do ladies sometimes try to deny that there is a problem?
Absolutely. We know that women are very reluctant to come forward to talk with their doctor about problems of prolapse or incontinence because it's a very personal issue and can be embarrassing. But thankfully, we now have many treatments available, both medication or physical therapy or surgery. So we're encouraging more and more women to mention to your doctor if you're having these kinds of concerns.
You said medication. Can medication most of the time treat the problems without having to deal with surgery?
I would say in many instances, yes. The most common type of incontinence in women, particularly older women, involves an inability to make it to the bathroom or urinating more frequently. And that's a problem that typically can be controlled with medication.
At what age would a situation like this start to be noticed?
Well, typically, women experience pregnancy and childbirth. And the process of pregnancy and childbirth can incur injury or damage to our pelvic organs, the muscles and nerves which are responsible for bowel and bladder control. So many women begin noticing after they have their children symptoms for the first time and may have symptoms for years before they talk to their doctor.
Before they talk to the doctor because they think, well, maybe it'll just go away, or I don't know if I really want to talk about this to somebody else. And you just try to handle it the best way you can.
Certainly, and treating the patient with respect and compassion and building trust over time, and encouraging them that this is not the same era that their grandmothers or mothers may have lived in, that we now have many treatments available for women where we might not have before.
And the fact also that they are not alone, that there are many other ladies who are going through the same ordeal that they are.
Extremely common. At least 1 in 3 women
1 in 3?
over the age of menopause experiences difficulty with bladder control. And about 1 in 5 women will have some type of surgery for prolapse or incontinence in their lifetime.
Okay, that's why we see all those medication ads on the nightly news. It's
Exactly.
Yeah,
incredibly common, and women may not even confide to their friends.
Okay, so if people want more information, where can they go to find out?
The best way to reach our clinic is by phone, 573-817-3165, or our website at MU Healthcare.
Okay. Dr. Lisa Brennaman, pleasure chatting with you.
Nice to meet you.
Delightful
Thank
lady.
you.
I'm so glad you came today.
Thank you.
All right. Now we're going to turn to MU Theater, and we have with us RONNIE RICE.
Hi.
Good to have you here,
Thank
RONNIE.
you very much.
And CAT GLEASON.
Nice.
You have a production that is opening this week.
Yeah, today. Yeah.
And it's called the Laramie Project.
Yeah.
Right.
Tell me about the Laramie Project.
Well, the Laramie Project is a play that came out of historical events that happened in 1998 when Matthew Shepard was brutally murdered. And what happened is he was beaten by two young men and tied to a fence out on the Wyoming prairie and left to die. He was found the next morning, and then he lingered in the hospital for 6 days after. And during that time, national attention was focused on this crime and hate crimes in general. And at that time, Moises Kaufman and his company, the Tectonic Theater Project, became aware of this situation, and Kaufman thought, perhaps we can go and talk to the people of Laramie and find out what happened there. How does this small town in Western America become the place where this horrible thing happened, right? So their thought was, perhaps we can talk to them and find out what happened. So
the production that you're doing then is a pretty heavy production, isn't it?
yeah, it's a serious piece. There are moments of levity, but it's mostly a pretty serious piece, and we're taking it very seriously with the cast and
So,
what we're
Ronnie,
doing.
what is the character that you're playing?
I play 7 different characters.
7 different
Yeah,
characters?
I play quite a bit. I played quite a lot of characters.
Is that difficult? When you've got to change personalities there?
Yes and no. It's difficult to have to do them so quickly, but it's not too hard, honestly, because we work so much on defining each character and body language and voices. And so once you get into the body language and then you get the voice on, it's very easy to then become that character.
Okay, playing 7 different characters and being in this production, what do you come away with?
What do I come away with?
Yeah, how do you feel about this?
I am honestly very honored to be a part of this show because it's so important and it's such an important topic that we need to discuss.
Has it changed your opinion about anything?
Yeah, it shows me how easily this kind of stuff can happen, honestly. How the level of tolerance is and how the way a town can view gay people and the prejudice that can happen and how deeply people can hate, honestly. It's very scary.
But there's also people can love very deeply
Yes,
too.
honestly,
And hopefully love conquers.
Yes.
Absolutely. I think that love conquers in this piece. And one of the things that we've kind of come across in working very closely with this text and these characters is this thought that it moves me very deeply, that it comes up over and over again to thank Matthew for the message that he has been able to give us about hope for the future and to change the way we see people in our country.
Right.
That several of the characters say, I got to see my town change. Thank you, Matthew, for giving me that opportunity.
While it was a horrific crime,
Yes.
Perhaps his reason for being was that,
Yes.
to open people's eyes.
Yeah.
Yes.
And if we look at it that way, perhaps some good comes out of it.
Yeah.
All right?
Absolutely.
It is the Laramie Project, and it's running through
The 30th.
through the 30th of April. Thank you so much for coming
Thank you
by.
very
Best
much.
of luck
Thank
with
you.
it. Okay, we're out of time for today. Hope you'll join us tomorrow. Boone County Hams will be singing. Bye-bye.